Hello, my name is Stephanie Nolting. I'm a physical therapist at PT Connections. We get a lot of questions on how to treat low back pain, and especially now while the coronavirus is going on, people want some tips and things to try at home while they're um, with the stay-at-home order, not necessarily under quarantine, or even if you are under quarantine. So back pain affects a lot of people across the country and around the world, and everybody has kind of different levels of back pain. So I'm going to show kind of a very basic, easy to do when I'm in a lot of pain, what can I do? Then I'll move on to a little bit more difficult exercise for a medium effort. And then I'll do a more advanced exercise for the person who has maybe occasional back pain. I don't want it to come back and I don't want it to get worse. But certainly that last exercise is not going to be for the person that's having acute, intense low back pain. So if the back pain's pretty intense, they're with you as soon as you wake up in the morning. Something you can do before you ever get out of bed is just simple knee rocking. So I'm going to lay down to show you. So when you're on your back, if you plan on just about an inch or two of movement with the knees side to side, that is all it will take to start to move the muscles from the legs. Even your ankles are at work doing a little bit of this knee rocking. So from the legs all the way to the back and into the back, this should be very relieving and easing. So no matter what position you were sleeping in at night, come to this position, try the knee rocking, and your back should feel a little bit better before you get up and go. Now the second exercise, which if you're in acute pain, most people will not like a bridging exercise, which is something that we do when we move around in bed. So if you started off at the edge of the bed and you wanted to move towards the center of your bed, a lot of people will lift and move. So if that in itself gives you pain, don't continue to do a bunch of them. But if you can do a bridging motion to lift your hips to get in line from the knees to the shoulders, then return down, and that does not give you pain, then you're a candidate to be doing bridges where you lift and lower. There's no magical number, but you want to get the glutes and the hamstrings a little bit fatigued, so you get the muscles tired. Sometimes if you have a little bit of pain when you initiate the exercise, but it goes away within 3 to 4 repetitions, then you're okay to continue the exercise, whether it's bridges or something else. The third exercise for the more advanced people who have kind of the chronic intermittent back pain, meaning it's been there for years, maybe months, kind of comes and goes, but I don't want it to get worse, and I don't want it to stop me from doing some upcoming event I might have. We want a stability exercise that challenges the back to give your back some stability, but also to decrease some extra tension that might be just holding down your spine, because a lot of times we have pain because of how much pressure and tension is around any particular area. So for this bird dog exercise, we're going to be raising an opposite arm and leg to go in line with the body. If you can do a 4-point position, meaning hands and knees, this is a nice stable way to start the exercise. We want to have the arm and leg in line with the body. We don't want to hyperextend necessarily and go beyond that flat line. And then a good 5-second hold is a good place to start from. If you go into that position and you find yourself wobbling around and it's hard to hold it, you might start off just going a little bit off of the surface, whether you're on your bed, which is really hard to do because it's a soft material, or from the floor. If you have no trouble getting on and off the floor, it's a better place to do this. So you could do a modified version where you barely raise the extremities off of the floor, or you can go into your full in line with the body. Again, if any of this causes you extra pain instead of just being a nice challenge, do not continue doing the exercise. But if it doesn't hurt while doing it, you will actually have a stronger, safer back by the time you're done and have practiced it several times. If you have any questions, you're always welcome to go to our website at ptconnections.com, or you can call us at 719-565-6678. Good luck with your back.